Diabetic blindness. So what causes diabetic blindness? Retinal damage, or the medical term is retinopathy. It is one of many diabetic complications that can affect you. In your eyes, the blood vessels in your retina, which is your retina is on the inside back part of your eye, you have micro blood vessels in the retina area, and they can become weakened and damaged and even leak blood. This leakage can lead to a condition known as diabetic retinal hemorrhage, or common layman term, eye bleed. Now, an eye bleed cannot normally be seen by you looking in the mirror or anyone else looking at you. Blood does not drip out of your eyes or shoot out of your eyes. Your eyes don't even look red. It's just in the back part of the retina on the inside. Some symptoms may include a sudden vision change, floaters in your vision, a shadow, or in my case, fog or a curtain effect in your field of vision. Well, I have been and I am currently suffering from diabetic retinopathy in my diabetic life journey. I have had diabetes for more than 30 plus years, but my severe vision damage issues only materialized in the last 8 years or so. My vision issues started with a severe loss of vision, first in the left eye and then in the right eye. And it was about 95% loss of vision. It was extremely foggy. Now, I could still see some light, but it was completely blurred, like a super serious fog. I couldn't see my hand in front of my face. I couldn't see people across the room. It was pretty bad. My doctor referred me to an ophthalmologist who dilated my eyes and used a special scope to look at the back of my eyes on my retina. And yes, he saw damage on my retina, and he referred me to a retinal specialist doctor. I saw several of these retinal specialist doctors who attempted to treat my vision damage by injecting medicine with tiny little gold needles into my eyes to help clot the bleeding. And yes, this was more painful than it sounds, but hey, I'm kind of a wimp, and they do numb your eyes with drops, but it was still extremely unpleasant. The medicine only lasts a few months as well and needs to be re-injected several times a year for this treatment to continue. The next treatment was to laser the retina area and basically, in layman's term, cauterize the little capillaries on my retina so as they're not to bleed anymore. Now, this did not go very well for me. Even on the lowest power settings in this large big city hospital, their laser machine, I was still screaming in pain while they attempted to treat me. Now, I do have blue eyes, and I was told by my doctor that the lighter your color eyes, the more highly sensitive they are to pain. So I was referred to another retinal specialist doctor who had brand new state-of-the-art laser equipment that could be dialed down extremely low laser power. This new retinal specialist doctor attempted to dial it down super low. He wasn't even sure if it would even work at that low of a laser power setting. But the problem was exactly the same. Even on that super low power setting, I was still screaming in pain and not able to tolerate the laser treatment on my eyes. So the doctor scheduled to put me under a general anesthesia, in other words, put me to sleep, and I only allowed them to do one eye at a time with a few weeks time between the treatments. The treatments worked good. Everything went back to normal for a few years. I thought my vision worries were over, but today, unfortunately, it's been about 5 years. Today, my eye bleeds in my right eye, even today. And it does so a few times a year, and they last a month or two with extremely diminished vision. And it takes a month, two, sometimes three to heal. And I've been evaluated again in 2024, and there apparently is nothing additionally that can be done other than more eye injections to stop these eye bleeds in my right eye. What's done is done. Now, I've been told by my retinal specialist in 2024 that the diabetes damage is, well, it's already been done. And no matter how good my blood sugars are today, my ongoing eye issues will not normally heal, but will continue to plague me. Basically, he said the damage has already been done. So I wish that I had understood this 30 plus years ago. And I often wonder if I would have taken such warning and information more seriously, or, well, maybe not. Always remember, as a diabetic, even before you experience noticeable eye issues, have your eyes and vision evaluated by your doctor. Even if you do not experience any eye or vision problems, don't wait. Get an urgent appointment if you have any vision problems and you're a diabetic. Get them evaluated immediately by your eye care doctor. It is critical you do that. Thank you so much. Have a fantastic day. Take care.